Hi everyone, we are Stanford Emergency Medical Services, also known as Stanford EMS. We're a team of trained emergency medical technicians who respond to medical emergencies in our community. We're so excited to be working together with the Formula Project and the Tent School to put this workshop together for you. Today we'll be discussing some practical skills that you can use to help if someone near you is hurt. You don't need to be a medical professional to make a difference. We hope that this workshop will help you feel a little more prepared to act if something serious happens around you. Most emergencies don't happen in hospitals. They happen at home, at school, on the street, while you're just living your normal life. And usually the first person on the scene isn't a doctor or a paramedic. It's just somebody nearby. That could be you. Even small actions can make a huge difference in these situations. Sometimes what matters most is that someone steps up and acts. But before we talk about specific skills, there's one rule that applies to every emergency. Your safety comes first, always. Before you help, pause and look around. Ask yourself, is the scene safe for me? Is there active danger, like traffic, fire, or ongoing violence? If it is not safe, do not rush in. Once you know you're safe, take a breath. Try to stay calm, even if your heart is racing. That's normal. And call for help as soon as you can. In Ukraine, that means calling 103 for emergency medical services. Remember, you can't help anyone if you get hurt yourself. We're going to start with bleeding control. Uncontrolled bleeding is one of the leading causes of preventable death in trauma. The good news is that bleeding can often be stopped with simple, fast actions. So let's talk about what dangerous bleeding looks like. Look for things such as bright red blood, blood that keeps flowing, blood pooling on the ground, or clothes completely soaked through. If you see any of these signs, the bleeding may be serious and you need to act quickly. The first thing to do is apply direct pressure. Use whatever you have, your hands, gauze, a clean cloth. Put pressure directly on the wound and press firmly. If you have quick clot or any kind of hemostatic gauze, apply the dressing to the wound. It will help the blood clot faster. If the wound is deep or wide, you may need to pack the wound by placing the gauze inside the wound while continuing to apply pressure. Once you start, do not remove pressure until the bleeding stops or help arrives.
Here we see the responder pressing directly on the wound. Keep constant pressure until the bleeding stops or help arrives.
If bleeding is coming from an arm or a leg and direct pressure doesn't stop it, you may need to use a tourniquet. Tourniquets are designed to stop severe bleeding that does not stop from direct pressure alone from the arms and legs only. They are not used on the head, neck, chest, or abdomen. First, always try direct pressure. If bleeding continues, place the tourniquet 2 to 3 inches above the wound, closer to the body and not directly on the wound. Make sure that the tourniquet is not placed over a joint, so not over the elbow, knee, wrist, or ankle. Pull it as tight as you possibly can. It should feel very tight. That's normal and expected. Twist the windlass rod until the bleeding completely stops. Then, secure the rod so it doesn't loosen or unwind. Make a note of the time the tourniquet was applied. This is important information for medical teams because tourniquets should only stay on as long as necessary.
First, place the tourniquet a few inches above the wound, making sure to not place it on a joint. Pull it tight and twist the rod until the bleeding stops. Secure it so that it won't loosen. Remember the time that you applied the tourniquet so medical staff knows how long it's been on. Please pause the video and practice applying direct pressure with a partner. If you want to practice applying a tourniquet, please be careful to not twist it too tightly or leave it on your partner's arms for a long time.
Next, let's talk about penetrating chest wounds. These can come from gunshots, stabbings, or shrapnel. Signs may include a sucking sound when the person breathes, or air bubbles or blood bubbling at the wound. If you see this, apply a chest seal immediately. Do not remove any objects stuck in the body. Always check the front, back, and sides of the chest. Sometimes there's an exit wound you didn't notice at first.
For penetrating chest wounds, you should apply a chest seal to help the person breathe more safely until help arrives. First, remove clothing to expose the site and clean the area around the wound of dirt or grime. Then, using the red tab, peel the backing off of the chest seal and apply it sticky side down such that the center of the chest seal covers the wound. Make sure the adhesive sticks to the skin all around. Remember to always check the front, back, and sides for any exit wounds. Do not attempt to remove any objects that may be stuck in the body.
Now we'll move on to burn care. Minor burns are burns where the skin is still intact. Cool the area using clean, cool water. Do not use ice because ice can cause further injury to the tissue. Severe burns may look like blistering or broken skin. In these situations, cover the burn with a dry, sterile dressing. Do not apply wet gauze to the burn, as it may stick to the wound when it dries, causing further damage to the area when medical professionals remove it. Do not pop blisters. Do not remove clothing that's stuck to the skin. The goal is to protect the area until help arrives.
If a patient has a severe burn, which appears as skin that is blistered or broken, you should cover the burn with a dry, sterile dressing, as you see demonstrated in this video. The reason we do not use wet dressings is that it may stick to the wound when it dries, causing further injury to the burn when it is later removed by medical professionals. Remember to not pop any blisters or remove clothing that may be stuck to the burn site. Gently wrap it so that the burn is protected but not constricted. Covering the burn helps prevent infection and keeps the area safe until emergency help arrives.
Pause the video and practice applying dry gauze onto a partner's burn.
Next, we'll be discussing what to do when someone is in cardiac arrest and hands-only CPR. Cardiac arrest happens when the heart suddenly stops pumping blood. The person might collapse, they won't have a pulse, they won't be breathing normally. Sometimes they make gasping or strange noises. That still counts as not breathing normally. CPR is a way to manually move blood through the body when the heart can't. It helps keep oxygen going to the brain until emergency help arrives. Here's an easy way to remember what to do. The 3 C's. The first C is for check. Check the scene for safety and the patient for responsiveness. Is the person breathing normally? If not, you should start CPR. The second C is for call. Call 103 to get emergency responders and get an AED if nearby. The third C is for compress. Compress an AED. Move the person onto a hard surface. Press hard and fast in the center of the chest at a rate of 100 times per minute and about 2 inches deep. Open and turn on the AED and follow its instructions. The first step is to check. Ask yourself, is the scene safe? Is the person responsive when you try to wake them? Are they breathing normally? Do they have a pulse? You can check for a pulse by pressing your index and middle finger to the side of the neck, next to the windpipe. Do not use your thumb. Take a second to find your own pulse on your neck so you know where to find it. If there's no pulse or no normal breathing, call 103 immediately. The next step is to call for help. Call 103 or direct someone nearby to call. Ask someone to bring an AED. AEDs are often found in places like train stations, schools, malls, and other public buildings. If you're alone, call first, then begin CPR. If you are less than 3 minutes from an AED, then call and get an AED first before beginning CPR. Move the victim onto their back on a hard surface. Expose the victim's bare chest, including if they're wearing undergarments. Place one hand on top of the other in the center of the chest at the nipple line. Position yourself over the victim so that your entire body weight is pushing down on the patient, as shown in this picture. Lock your elbows and use your body weight, not just your arms. Push hard and fast, at least 100 compressions per minute, about 2 inches deep. Let the chest come all the way back up after each compression.
Here, the responder demonstrates the appropriate hand positioning for CPR. 2 responders find someone unconscious on the ground. One checks for responsiveness by rubbing on the chest and calling out. Finding no response, they check for a pulse on the neck and look for normal breathing. When there is no pulse or breathing, one responder leaves to call 103 and grab an AED, while the other starts chest compressions. When a second responder arrives, you may want to switch who's doing chest compressions. Make sure to count off out loud and communicate with the second responder to keep interruptions as short as possible. Even a few seconds without compressions can reduce the victim's chances of survival.
What is an AED? AED stands for Automated External Defibrillator. It delivers an electrical shock that can help restart a normal heart rhythm. Every minute without an AED decreases survival by about 10%, which is why early use is so important. To use an AED, first turn it on. Some AEDs will turn on automatically. Apply the pads to the patient's bare chest. If there are two responders, one can continue chest compressions while the other places the pads. When the AED is analyzing the heart rhythm, do not touch the patient. If the AED advises a shock, do not touch the patient while the shock is delivered. Immediately after the shock, or if no shock is advised, resume chest compressions right away. Keep going while the AED recharges and continues to give instructions.
When the second responder arrives with an AED, turn on the AED and follows its voice prompt. Plug in the pads and apply pads to patient's bare chest, as demonstrated in the video. If there are two responders, one can continue compressions while the other applies the pads. The pads will detail where you should apply them on the pads themselves. The AED will analyze the heart rhythm. While this is happening, do not touch the patient. If shock is advised, the AED will say so. Resume chest compressions while the AED charges. However, do not touch the patients while the AED delivers the shock.
Please partner up and practice the 3 C's: check, call, compress, with a partner. Finally, we will discuss what to do when you see someone choking. Signs of choking include inability to speak, cough, or breathe, hands clutching the throat, high-pitched sounds or no sound at all, panic or distress, or turning blue around lips or the face. If someone can cough or speak, encourage them to keep coughing until the food is dislodged. However, if they cannot cough or they are not able to dislodge the food from their throat, stand slightly to the side and behind the person and give 5 firm back blows between the shoulder blades. If that doesn't work, give 5 abdominal thrusts using an upward motion. Continue alternating until the object comes out or the person becomes unresponsive. If they become unresponsive, begin CPR.
If someone is coughing, encourage them to keep doing it. Sometimes a strong cough is enough to clear the airway. If coughing isn't enough, give 5 firm back blows between the shoulder blades, then 5 abdominal thrusts from behind, using an upward motion. Make a fist with one hand and cover with the other. Place your hand just above the person's belly button.
Pause here and practice the back blows and abdominal thrusts with a partner.
Thank you so much for attending our workshop. We hope you feel a little bit more prepared to help in emergencies. We're grateful to the Formula Project, the Tent School, and all of you for being here. Thank you so much to all the members of Stanford EMS who made this workshop possible. Stay safe and thank you.